So here we have Mr. Keith, is one of the lecturer and coaching expert from Knowledge from Dummies. So we will pass to him the session in short while. But before that, I'd like to thank Mr. Rao for the arrangement, all the arrangement he did. Really appreciate
Thank you, bro.
Thank you very much.
Thank you so much.
I would like to, appreciate, I don't know, to appreciate or to thank you that you are doing some good jobs as well, doing some fundraising for lower income people. I saw your story last week, which was
Thank you, bro.
really good
Yeah,
intention you're doing. So
just
hope
trying to help people.
all of us can support you as well.
Correct.
So
Yeah.
without a further delay, shall I pass the session to Mr. Keith, lecturer?
Sure.
So
Can't wait
I'll
to
pass
talk,
to
bro.
him, and you guys can continue the live session on COVID-19. All right, thank you.
Okay, Mr. Avi, thank you so much.
Okay, hi, Mr. Rao. So
Hi,
nice
Mr.
to meet
Keith.
you. I can
Nice
call
to
you
meet
Rao
you.
only lah. You call me Keith only, don't worry.
You can
Yeah,
call
a
me
bit,
Rao, no
a bit
worries.
informal on this lah. Yeah, very thankful for you to sharing your experience as a gym fitness advisor and the gym trainer, and also your experience as a recent patient that has recovered from COVID-19 with us. So we understand that a lot of people actually they are aware, but somehow they are not so serious about this pandemic issue itself. We can still see that a lot of people still mingle around in those mama shop late at night without wearing masks, or even go out touching everywhere, every surface, and then they just straight away touch their nose and mouth itself. So the awareness is there, but they don't seem to treat this pandemic seriously. So we like to invite you as one of the recovered patients to share your information and your experience about this disease itself. How serious is it, and how this disease actually changed your life? Is it
Okay.
okay?
Yeah, can. Of course, can.
Yeah. Thank you so much, Rao. Thank you so
My
much.
pleasure, Mr. K. Yeah,
So,
it is something that cannot be taken lightly. It is serious
mm,
because you can easily pass it to somebody who has underlying conditions or older than you. And
mm,
once you have spread the virus, you will feel very
yeah,
heavy-hearted because you are putting somebody else's life in danger. Because usually young people you can recover fast, but if somebody who is not as lucky as you get it, they can be in serious trouble, even can lose their life. So it's not a joke, very serious virus actually.
yes,
Yeah, so
I
people must, correct. People must take
I agree
the
on that.
yeah,
They should understand that actually the precautions like wearing masks, using sanitizer, social distancing,
correct.
they are not doing for their own health. They also doing
True,
for older generation that is at home. Example,
correct,
their mother, father, or grandfather, or even for younger babies itself. Because
correct,
once we get it, the younger people, example in age 18 to 30, we can recover faster because we have better
correct,
stamina, better antibody. But
correct.
those old one is actually very difficult. So we take precautions is actually for them more than for us.
Correct. It's like we if we follow all the SOP, we can prevent it from the community lah. Because if we don't follow, we are putting the community in danger. That one we don't remember. This one is not this virus is everybody has to play their part to
Yes,
stay safe. Yeah, it's
I
not it's not a solo. We can't fight it alone. We have to fight it together. So everybody has to play their part by not going out much,
yes,
staying
but
home.
but
Yeah,
but somehow we can see the cooperation between all people are still not that much. I can say it can be like 70%, but still around like 30% of people they are not playing their role. So we hope that actually this video itself can actually create awareness to more people out there, so they can know
correct.
from straight away from you we have this experience recovered, and
Yeah,
learn from you how to actually be more precaution and take care of their well-being. Okay.
correct.
So,
Yeah.
Mr. I want to ask you, for your COVID-19 symptom that you have previously. So, how
Okay.
do you notice you have this COVID-19 symptom? What are the things that you observe on yourself before you are detected? So, what are the things you begin to observe in yourself? What are the changes? What are the sickness that you experience that lead to you believe that you have this COVID?
Usually when I go to gym, my body doesn't hurt a lot after working
Mm,
out. It doesn't hurt much, but from like before the day I got tested, 2-3 days I was feeling like extra joint pain and feeling very uncomfortable suddenly. Not so much, it feels like a normal sickness. So suddenly I had sore throat. And I had joint pain. And I slept, all my back all hurt a bit. And I had slight fever. So I took Panadol and I went still and played football and all is all okay. Because when you're young, your immune system is good. So when you take Panadol, you'll feel good already. But the next day, I still had the joint pain and the sore throat. So since it is COVID time, I took my own initiative to go and get checked because I had a flight to catch that day. So I didn't want to put anyone in danger. So I went to the hospital just to check. My friend, actually one of my friends was a doctor. She told me in Instagram to go and check first for safety because she told me that young people won't feel the symptoms much. So better check. So I went to the emergency. They first took my blood. Then they took my blood pressure and they took my x-ray. And they said all looks okay. They said it doesn't look like a COVID patient. It looks all clear. But then I told them that I'm living with my grandmother and she's 86. So I'm worried if I have it. So I told them, can I do a COVID test? Because I work in gym and all, it's high risk environment. And they said, okay, can, because Klang is red zone. So they said you can check the next day.
But the test, is it being charged?
No, it's free. It's free. For Malaysians, it's free,
In government, right?
Correct. So that is why I went to check. So even when I went to emergency and checked, I couldn't know that I had COVID. Even the doctors were not sure. So when you have the symptoms, you have to go to the government hospital. You have to explain to the doctor and you have to get a COVID test done. It's because I felt very healthy. I just felt a slight sore throat only. I just went on with life, but I would have spread to many people. So you have to take your own initiative to go and get checked. Then I did the swab test there for free.
It is very good that actually you keep alert on this and you keep the spreading to be minimum. So I believe that everybody that out there that have a little sickness, example like a little bit fever, sore throat and muscle ache as what you experience, they are actually recommended to follow your footsteps to get a test itself because it is free first. And second, the government are providing this medical support, which is very supportive to us. And I believe we must play a role. So when people like you go to check first, I believe it's actually for the sake of every person, not only for yourself. We are not being selfish over here.
True. Yeah, especially for my family.
Yes,
friends. True.
Need to somehow take care of them, right? Take care of their well-being, so we become cautious for ourselves first.
Correct. Because if old people get it, sure, very hard to survive. If you're 80, 70 plus, very hard to survive.
Yes, especially those that have like kidney disease, high blood pressure, those kind of passive disease, hidden disease. Normally those that have medicine to control one, they still can survive. But once get COVID, the death percentage is very, very high for them. We can see recently the news, a lot of people that die is old people with this sickness itself, with this long-term passive sickness.
True. Mr. Kid, I got a question for you.
Yeah, sure, thanks.
So what made you guys come up with the COVID-19 awareness video? Like, I'm amazed that you guys did it.
Yeah, thank you so much for supporting the video. We actually, I made this video together with my teammates here, Mr. Avinesh. So he's the photographer, I'm the speaker of the video itself. Our intention to come out with the video is actually to create more awareness to all the people out there so that they know more about symptoms and prevention methods for this COVID-19. I find that each of us need to play our role, but sometimes when after work I go back, I still see along the road, still have people that is loitering around. They are not cautioned about this thing and they take this sickness lightly. So we hope that actually our video can give impact to all of them, actually create more awareness, and so that they can actually make these prevention tips that we share in the video as their habit to play a role to curb this disease together as a Malaysian.
Well said. Very responsible Malaysian. That's why you're a lecturer, educator.
Thank you very much. Same to you.
My next question, is in short, right? Can you say what is the content of the video? Like, what do you guys focus mainly in the video, like the content?
In the video that we made about this COVID-19 awareness, actually, in short, is we talk about first is the symptom itself. What symptom that you observe during the early stage and the later stage. So we segregate, like example, during the early stage, the person may observe, it is reported in research papers that the early stage of COVID-19 people, before they have sore throat, they may actually experience rashes in their fingers. Okay. And then they begin to lose their sense of smell and their sense of taste. So even they're eating those like curry, they can feel like it is like water like that. So even when they are smelling a flower, they cannot smell everything. So it can be some hint. After that, it progresses to be more serious, like fever, sore throat. If it is not treated, then you will go to breathing difficulty, So that one will begin to influence the lung. That time they need this ventilator to help them. No? Other than that, also we share some prevention methods. Example like how to wear mask properly, what type of mask, what kind of sanitizer to be used. So and also we share like example like they go out, they buy groceries. We actually encourage them to rub their groceries with this antiseptic before actually they bring their groceries to their house, because COVID can actually live in multiple surface for different hours and different days. Example like for money and money note that we use. Okay, it is believed COVID can be spread from money in China. So that's why China actually implement e-wallet, because this COVID detected they can live on the money paper for around 2 weeks itself. So we are exchanging money. So we are also exchanging the risk of getting COVID.
Oh my God! So we have to sanitize our hand even when we use cash, so
Yes, it is actually recommended we sanitize our hand even we use cash or shilling. That's why I recommend if people go out, we can use example like credit cards or even e-wallet. If let's say really cannot, only we use cash flow, but remember every cash is being touched by everyone during the transaction. So it's better we sanitize our hand itself.
True. Even like I'm very glad you did the video, because I see a lot of people they going like now Deepavali, they going Indian street, they shopping just because they haven't get COVID they think they won't get it. Like I also felt like that before this. When I felt like, oh, cannot get sure cannot get one. Then I'm so surprised that I got it. Like I was like in disbelief. People think they cannot get it, but it's in the community. They're not taking it seriously. That's the thing. I see a lot of people like taking it. When you see any video about COVID, they take it lightly. I don't know to watch That's their point.
Because we human are actually in majority of us in denial behavior. So denial behavior means you not get it something, you believe you will not get the bad things. You believe the bad things happen on other people easy, happen on ourselves harder. But the truth is everybody have the risk of COVID is evenly 50-50. Either you get or you don't get 50-50. But those people that go out, they must be responsible. I see before also there are people going for shopping. They themselves wear masks, but their mask is just underneath the nose.
I see that a lot.
Just cover the mouth only for the sake of not getting this fine or summon from this police. And then they put their babies and their children aged around 10 years old on the trolley. Then the baby don't wear mask. So the baby just touch around the trolleys, and that trolley is being touched by so many people. So the baby don't wear any mask, so they touch their hand, something like that. So if the baby get the COVID, the parents get, then the elderly also get in the house. That's why this COVID spread so widely in the world, because awareness is not there. Yeah, they always feel that there's one word that they think this COVID-19 is other people's business, not my business. But it's become our business once we get it, or our friend get it, or our relative get it, or our neighbors get it. Only the thing come here, next door, you heard someone next door get it, you only become afraid. That is human nature.
Like usually people stay in house, they won't put CCTV. The neighbor get robbed, they put CCTV.
Yeah, same example lah. So this is something like belum kena belum tahu lah, sudah kena baru nak sedar lah.
That's why I did the video also, because I'm glad you did, because I did the video because first I was very shy and very I feel embarrassed because I got it already and don't know how to share. I scared people will talk. But then I did it because I want Malaysian to take it seriously, because people think it's easy, like it's nothing. They don't know that you can die.
I find the recover is actually hard, right?
Correct. It's not easy. You lose your smell, you lose your taste. Sometimes night you cannot breathe in the hospital. Yeah, imagine I am 24. Most of us, most people 24 are relatively fit, and you still can go out of breath sometimes. That's damn scary. And if your parents get it, it's damn bad already.
You can share with us what are the experience you have in the hospital itself when they detected you get COVID, right? I think they should do some treatment or some quarantine to you. Can you share with us here so that people out there actually know, besides getting COVID, they themselves sick, they need to undergo all this treatment that actually need to take blood tests, nose tests, everything, right? You can share with us here so that all of them are more aware.
Can. So first thing they did is they did the swab test. Then they gave me a letter. I have to sign a letter that said I have to be quarantined at home until I get the results. And if I go, my Sejahtera will be banned. So if I go out and scan accidentally with my phone, I will be fined 1,000 per shop.
Oh, okay. What, 1,000 per shop? Is legal go bankrupt or what?
Yeah, your Sejahtera will be blacklisted. So every time you tag, they will know that you're out. So you cannot be so smart. Yeah. And then once the result comes, KKM will ask your contact tracing. So the My Sejahtera is very important. They will check your history. If you never scan, you're making their life hard. So you must send them screenshots of your MySejahtera for the past 14 days. You have. So MySejahtera is very, very important. It's not like you don't feel leceh or you must scan. And then they will send an ambulance to your house to pick you up and they'll send you to Sungai Buloh. If you are stable, they will send you to PKKN, Pusat Kusta Kawalan Negara. That's the last time one they used for pandemic. Then if you're not stable, they'll send you to Sungai Buloh Hospital, the what? Yeah, so from there they will check. Yeah, correct.
So once reach the hospital, what kind of treatment they give you? Can you share with us your experience in the hospital itself?
Sure. First, they will put you in a ward. It will have 15 people who are COVID positive. So they'll put you together with other people because it doesn't jump from COVID to
They don't
COVID.
care lah. You are COVID serious or COVID mild, all the same COVID stay together,
No,
right?
if you're serious, they send you to the hospital.
Uh-huh.
Yeah. If you can still walk and breathe, all you're not so serious ward. So they send you to the normal ward.
Normal what is the quarantine center lah?
Quarantine center, correct. Then they will take your blood pressure first. The most important thing, we think they do the nose swab, right? No. They will check your blood pressure twice every day. That is the most important indicator.
Okay.
Because the blood pressure can explain is your body fighting it well or not.
Understand. So if they want to check if your blood pressure increase or drop suddenly, right?
Correct. They will check the fluctuation of the blood pressure and they will check your blood every few days once. In the morning.
So they need to stick the needle in your hand to take out the blood by.
It's not fun.
By lots, right?
They'll take your blood. Yeah, they'll take your blood so many times. They will check your pressure. They'll wake you up in the morning at 3 o'clock. Yeah, and then you lose the losing smell and taste is very real. Like I was eating tandoori chicken and curry. I couldn't smell anything. I felt like eating paper.
Okay.
Yeah,
That was
scary because imagine 24 years of my life I got sense and suddenly few days no sense. Very scary lah. Tell you, panic. That was panicking lah. Yeah.
That is actually demotivating lah for us to be healing, right? We must have a good food, something. But when you cannot taste any food at all, you can have a demotivating feeling, right?
Your mental strength will be disturbed a lot lah because you already feel very down. You're already locked in a place, and everybody around you, your relation, your family will feel you are the one who brought the virus. They don't understand how the virus works.
Yes.
They will blame you. Yeah.
They will begin to, no matter how close, I think they will begin to avoid you. I do believe. I do believe this causes some relative or friends to avoid you for a certain period.
To be honest, I felt that more than the virus, the people's words were more hurtful.
Okay.
Yes.
But during the hospital one, the swab test, how they do the swab test with you? You can share with us. Is it painful?
Okay. It's not so painful, to be honest. You know when you go in a slide and you enter the swimming pool, the water near your nose, you feel the same way. Only 3-second pain.
Okay.
Yeah.
So they take the poke inside.
They poke, they just twist it, then they take it out. Then they put on your mouth also. So your throat and your nostril. Yes. Correct.
Okay.
Correct.
Then after that, if let's say during the hospital they quarantine you, they got give you proper food but what kind of medicine they give you there? Is there any kind of treatment actually exists now, or they just give you normal medicine only?
They only can treat your symptoms because there's no medicine yet recorded for COVID yet. So if you got flu, they give you flu medicine. They give you fever, they give you fever medicine. Normal medicine only they give you. Yeah.
Just normal Panadol.
Only if you're serious, I think they give you antivirals because one of my family members got a bit serious. They had to give antivirals and all. Something like that. Yeah. Usually the older people, it's damn painful because they give like 4 to 5 injections a day. They take blood twice a day. So if your parents get it, forget it lah. It's a headache lah. It's very hard.
Understand. That's why we hope actually people are more responsible. They actually stay safe is for their parents and their old people in their home, not only themselves. I find a lot of people think that babies and kids won't get it, so they don't care their baby and kids, but they care their parents. But for me, I see news baby and kids die as well.
Correct. Young also very risk. It's actually any age. It doesn't matter any age, so you can get it.
Yes, that's something that I think all of the people in Malaysia should be aware lah. It doesn't segregate by age. Although the risk of getting death in younger people is lesser, it doesn't mean no lah.
Correct.
Then after that.
Yeah.
I want to ask for the hospital, how they know that actually you recover from COVID? What procedure they use to determine you recovered?
They will check your blood because the COVID is only can spread only in the first few days. So once the count reduces in your blood or something like that, they will release you.
Oh, so they use the count of the
Yeah, they won't check. They won't swab test you again. They will only check the blood.
Oh, okay. So they
Yeah.
what you know what property they check in the blood?
I'm not so sure about that, but they said once they can rectify that you can't spread anymore, they let you go out. And once your symptoms already recover.
Okay, okay. So it means
Yeah.
that they have qualified that it cannot be spread lah. So we the recover one
Yes.
won't be silent spreader lah.
Correct. So minimum 10 days you must be from the symptom. From the first day of symptom, 10 days you must be quarantined. And after that, you cannot spread anymore. So you are safe. You are safer than the people outside.
Understand.
and
Understand.
you are immune to the virus for a few months to a year lah, they said.
But somehow
Yeah.
somehow we see the cases of the virus actually mutated several times already. Yeah. So that the vaccine to get a mutated virus is like chasing a never-ending road. So I believe that
Correct.
even recovered people also need to take a bit more serious on the precaution as well.
True.
It's not that it
Because
will
new
never come
strains,
out,
yeah,
it will come
it
out,
can
but
mutate. Correct.
to take more precautions because we feel it, the pain already.
Correct. It's not easy journey lah. It's very tough. Very hard on the mental lah, the journey. Yeah.
Understand. It's a
even
challenge.
when I came
But
out, yeah.
after that, do you do some self-quarantine more? After you discharge from the hospital?
Once you come out, you can go out already. But to be honest, all the patient I know, we talk to each other. We were scared to go out for a week at least because we are paranoid. Yeah, we were paranoid. Yeah, that's why. So you don't have to quarantine, but usually people feel paranoid lah. Yeah.
You got quarantine yourself after you discharge for how long?
I say I don't have to quarantine, but I quarantined for 4 or 5 days. I was scared to go out. I had panic attacks and all, so I was a bit scared to go out. Yeah.
For the safety precaution lah.
Yes.
Just for guaranteed only.
Correct. Because they say.
Then after that, I want to ask you after the COVID.
Okay.
After the COVID, what kind of impact it give you to your life? Can you share with us what lesson you learned or what kind of impact this COVID-19 had on your life?
What I learned is must be more grateful for life lah. Every day waking up is a blessing.
For sure that one. Actually, health is wealth. Many people say health is wealth.
Correct. And one more thing I really appreciate is thank God I worked out and eat healthy, so I can recover in 5 days, 6 days already.
Yes,
yeah, I saw my roommates who don't work out, they suffer a lot in the what. So
yes.
To be honest, you must exercise, you must eat healthy if you want to recover fast.
I understand because that our resources, we are what we eat and we are what we do, right? So
correct.
You are a gym fitness trainer and also a gym exerciser yourself. I believe I also get surprised you recovered very, very fast. So I actually also like to promote everyone that actually health conscious can actually learn how to do gyms, how from you also. So that once they have this awareness of keeping healthy lifestyle as normal, even before COVID, once they have keeping a good lifestyle, I believe their stamina and antibody will be as good as yours. So like although you get COVID, but you recover very fast. Thanks to all the gym do all these years and the healthy living.
Before this, the good part of COVID is before this, nobody knew that gym and eating healthy can help. Now they got proof that this guy can recover fast because of his habits.
You lead the example for them to have a healthy lifestyle. Actually, not only make us recover faster from COVID, actually make us also prevent a lot of diseases, hidden diseases.
Correct. True enough.
Okay. Then for the COVID itself, I believe it gives a very huge impact to all of people beside you as well. How is other people perception towards you after you recovered?
After I recovered, they feel more glad because they can see somebody who recovered. Now they feel they can fight the virus more confidently, I feel.
Understand.
And they are more careful because I explained to them my journey. So they know the seriousness of the COVID virus. So now I see my friends and family more aware, more alert, more wearing masks when they're going out, not taking it lightly anymore. Yeah. So I felt my journey helped them a lot. Yeah.
I'm glad to know that actually you can spread the awareness to more people so that they are more aware of these health conscious things. So
thank you,
for
sir.
that actually want to know more about this gym trainers activity, healthy eating, I think they can consult you on this.
Thank you, sir. And
Yeah.
guys, for whoever wants to know more about how, like the awareness, do check out the video from Mr. Kid in Knowledge for Dummies in YouTube.
Yeah, thank you very
I
much.
will share the link after this.
For those that want to know more about this, I actually share the video on this symptom and precaution methods lah in the YouTube channel. So my YouTube channel is Knowledge for Dummies. Okay, I choose the name because I find there are a lot of for dummies series. So knowledge is actually a very important thing. So for people that do not know that info, they are called dummies. But once they know it, they are called experts. But I hope that this COVID-19 symptoms and prevention methods video can create more awareness to all people itself. So after that, besides the video talking about COVID-19 education, food, financial planning, even health conscious issues on that, we also hope that in the future, invite you, Mr. Rao, to give a talk on financial talk and even health.
I would love to come to Malacca. I would love to come there. And sir, thank you so much for inviting me. I feel very honored that a qualified lecturer, inviting me on the talk. Thank you so much.
Thank you so much for supporting us also. Thank you for being a good interviewer for us. For you, you are the celebrity in gym training itself in Selangor, Klang area. So thank you for sharing your experience with us here. We hope that this video can actually give more alert and awareness to all people out there.
True, sir.
Okay, thank you very much. With this, I pass the channel back to Mr. Avinesh.
Okay, sir.
Okay, thank you very much.
Okay, thank you, Mr. Kid.
Yo, hello.
Yes, Mr. Avi.
Mr. Rao is not celebrity in Klang Valley. He's a Malaysian celebrity now.
No lah, this one normal.
So I guess that's all I think from our side. Thank you, Mr. Rao and Mr. Kid. Okay, so I think that's all from our side.
Yeah.
I think we shall end our. There are some comments there.
Okay. Thank you, Mr.
From
Avi.
Delvin, all our friends only.
Okay.
All right. Thank you, Mr. Rao, for whatever you have done, and keep doing whatever good things you are doing.
Thank you so much, Mr. Avi.
All right. Thank you very much. See you all.
Okay.
Bye.
Okay, see you.